How do I know if stubborn weight gain is from menopause or a thyroid issue? This question almost always comes with frustration. Women don't usually say it casually. They say it with confusion, with anger, and sometimes with shame. I didn't change anything. I'm eating cleaner than I have ever eaten before. I'm working out more. My clothes don't fit. My body feels like it's betraying me. And the part they don't always say out loud is, I don't recognize myself in my mirror. I used to know how my body worked. Why does nothing I do make me respond? So let's start here. Weight gain in your 40s and 50s is rarely about calories, and it's almost never about willpower. Could it be menopause? Yes. As estrogen and progesterone shift, especially when progesterone drops first, your body becomes more stress sensitive. Fat distribution changes, water retention changes, and insulin sensitivity shifts. Could it be thyroid? Yes. If thyroid signaling slows, even subtly, metabolic flexibility drops. You burn less efficiently. Recovery slows and energy dips. But here's what almost always sits underneath both of those: chronic stress physiology. When cortisol is elevated or dysregulated, your body becomes protective. It stores energy instead of burning it, and it prioritizes survival instead of optimization. It increases insulin resistance, and it holds on to fat, especially around the belly, because belly fat is metabolically protective in a stress state. Hi, I'm Dr. Casey Tramp. I'm a licensed medical doctor and functional medicine practitioner. I focus on helping women suffering with tough and challenging thyroid and hormone issues. My approach to complicated thyroid and hormone issues is very different from others. In my practice, I utilize the very best of traditional medicine along with the very best of functional medicine to help my patients regain their health and get symptoms under control. How do I know if stubborn weight gain is from menopause or a thyroid issue? So here's what most women don't realize. Undereating and overexercising, which many women do when they gain weight, actually increases that cortisol further. So you restrict more, you push harder, you do more HIIT, you skip meals, and the body interprets it as even more stress, and it holds on even tighter. It's not stubborn, it's being protective. When I see women who feel like their metabolism is broke, what I often see is a system that hasn't been in fight or flight way too long. And when we calm the nervous system first, we stabilize your blood sugar, improve your sleep, and reduce your cortisol spikes, the body often becomes responsive again. Not instantly, but steadily. We can fine-tune your thyroid, we assess your insulin resistance, and we optimize your progesterone and estrogen balance. And suddenly, the same woman who felt like nothing was working says, I'm not inflamed. My belly is getting smaller. I'm not craving sugar at night. My body is just feeling more cooperative. And weight gain is rarely random. It's communication. So the question isn't, is it my menopause or my thyroid? The question is, what is my body protecting me from? When we answer that, the strategy becomes clear and far less punishing. Visit the link you see with this video to schedule a consultation with our office now. We'd love to explore how we can help you and any unresolved hormonal issues you may be dealing with.